have to try and do this in a way that we do not.
It was my understanding that that was the sentiment of a large number of
Testing 1, 2, 3, 4, 5.
You're not feeling.
Committee will come to order. Today, the Budget Committee is pleased to welcome Dr. Louis Sullivan, the Secretary of the Department of Health and Human Services, to testify on behalf of President Bush's 1990 budget. Dr. Sullivan, it's a personal pleasure for me to welcome you here this morning and just to say to you, sir, that your job is among the most important in the federal government, in my opinion. You have responsibilities for programs that affect the lives of virtually every American citizen, whether it's providing Medicare to the elderly, health care to low-income women and children, finding cures for AIDS and cancer, or maintaining a strong Social Security system which provides basic income security for millions of elderly Americans. I would say to you, Dr. Sullivan, that so far it's been difficult for some of us really to get to the bottom of what many of the Bush budget priorities are for your department. The administration's budget document does not, for example, tell us very much about priorities for maternal and child care, community health efforts, or the community services block grant. So I think it will be of immeasurable help to us, Dr. Sullivan, to have your views on how the department may want these programs funded. In other areas, the administration has proposed substantial funding increases for some very, very worthwhile programs. One, Head Start. I'm enthusiastic that the administration has seen fit to enlarge funding for this program, and I'd like to see the Head Start program in the years ahead to be enlarged even further. I'm pleased to see that there's additional funding for AIDS research in the administration's budget, and I applaud these initiatives. I might say parenthetically that I sure hope we can find a way to pay for them. But I might say also there's some short-sighted portions of the department's budget in my view. Perhaps the most glaring is the $5.2 billion reduction proposed for Medicare, a reduction that would take some $57 billion out of Medicare over the next 5 years. The administration budget suggests that a $5.2 billion reduction would have no impact on services for Medicare beneficiaries. I seriously doubt that proposition. Cuts of the magnitude that are being proposed, I think, are going to result in hospital closures. For example, in my state of Tennessee last year, we had 4 hospitals which closed. And we're told that with these Medicare cuts, 2/3 of all the hospitals will lose money caring for Medicare patients. And this comes on top of many hospitals telling us informally that they're losing money on Medicaid patients. And this will, I think, precipitate a real crunch for rural hospitals around the country and for the major teaching hospitals in many of our urban areas. The budget proposal also calls for $16 billion more in Medicare beneficiary premiums in the next 5 years. Now, these premiums that are paid by the beneficiaries come on top of new catastrophic premiums passed last year. So, unhappily, the Medicare beneficiaries of this country seem to be told that they're going to have to pay more and get less for Medicare in the years ahead. Well, I hope that's a situation that we can avoid, Dr. Sullivan, and I hope that you will review this budget again and use your good offices and powers of persuasion and influence with Mr. Richard Darman, the Director of the Office of Management and Budget. Convince him not to be so hard-hearted on some of these programs. Mr. Darman, on occasion, does evidence a soft heart, and maybe you can soften it up even more and see if we can't enlarge on these programs that impact so beneficially on the American people. I'll turn now to Senator Domenici for any comments or statements he may wish to make this morning.
Thank you, Ben. It's a pleasure to have you here, and I've not had the privilege yet of talking with you personally with rest, but let me say I'm also aware that you have not been in the position of Secretary for very long, and I, for one, understand that with reference to this hearing. But you probably already know that exceeded only by the United States, the Soviet Union, and Japan. That's a rather formidable thought. Social Security, critical welfare programs, Head Start, which has been mentioned by our chairman, serious issues like biomedical research. And I want to take one of those in a minute and tell you about my interest, but one of your programs, Social Security, is so big now that it is not only discussed in terms of your budget is not only big, but from my reading of the President's recommendations, you're in a growth budget in real increases throughout this budget, and strangely enough, you get 25. Just return to Medicare for a minute. Medicare and Medicaid are two of the fastest growing programs in the federal government. I hope, if you are not, every year. And it's now about 11% of our gross national product, and there is no industrial nation that comes close. So these are real serious issues. Seems to me that as you look, these will lend some real study to these programs, not by way of hurting anyone or taking away benefits, but trying to make a little better sense out of it and perhaps get a better delivery. Payments per year to those entitled to benefits will exceed the annual payments to Social Security recipients, who will in the actual benefit checks to the Social Security recipients. Those happen to be just true facts, and they deserve a lot of attention. My last thought, Chairman.
Thank you very much, Senator Domenici. We'll turn.
I'm pleased to be here today in my first senatorial appearance since my confirmation by the Senate some 7 days ago. I wish to discuss with you President Bush's budget proposals for health and human services. I'm pleased to enjoy the trust of our new president, and as Secretary of Health and Human Services, I shall carry out the trust that he's given me in such a way that the hopes and aspirations that we mutually hold for this department and for the American people are fulfilled. Today, I'm privileged to have the opportunity to discuss with this distinguished committee the broad contours of those hopes and aspirations. They center on the President's commitment, a commitment I fully share, to the ideal of a kinder, gentler America. No department will be more directly affected by that commitment than Health and Human Services, which touches the lives of all Americans, wherever they are most vulnerable, from the beginning of life, through health and sickness, from the foods we eat to the medicines we take, to the care of our elderly and disabled among us. Taking that commitment as my guide, I intend to see to it that our policies carry a firm, though gentle touch, that our employees within the department take pride in the services they render to our fellow citizens, and the government itself comes to have a more human face. Bringing a new spirit of kindness and compassion to a vast federal department of 114,000 employees may seem excessively idealistic, but it is an ideal we can attain. Nothing less shall be my goal as Secretary. During my medical career, I've seen remarkable progress in our nation's system of health care, with programs like Medicare and Medicaid, making health care available to the elderly and to the poor. I've seen improvements in the lives of our children and less privileged through the programs of this department. Nonetheless, much remains to be done, but it must be done with an eye towards reducing the federal budget deficit, a concern I know is shared by this committee. Let me indicate how we might begin to make further progress towards improving the health and well-being of our citizens, bearing these budget constraints in mind. First, we are committed to assuring the solvency of programs like Social Security and Medicare. We must find ways to contain escalating costs, as already mentioned, without sacrificing our commitment to quality health care for all. And we must emphasize health promotion and preventive medicine strategies, because promoting health is ultimately more humane and more economical than merely treating illness. In only 6 short years since the Bipartisan Commission put the Social Security trust funds back on the road to solvency, we can report that in 1990, trust fund income will exceed outgo by nearly $69 billion. The combined reserves of the Old Age and Survivors Trust Fund and the Disability Trust Fund will be approximately $229 billion by the end of 1990. And by 1992, the trust funds will have a full year of reserves. The reserves are necessary and will be used to fund the benefits of the baby boom generation as they begin retiring after the year 2000. President Bush proposes to increase Medicare spending by about 10%, or a total of $8 billion in 1990 compared with 1989. Thus, we are restraining the increase rather than having an absolute cut in dollars, while at the same time, we must restrain excessive growth in our healthcare system. Second, we must sustain and improve programs like Head Start and Aid to Families with Dependent Children, programs that help the poor learn and work their way out of poverty. Thus, implementation of last year's welfare reform legislation and the Family Support Act will be one of my highest and earliest priorities. The Act's most fundamental change was the creation of a new program of work and job and training activities, the Job Opportunities and Basic Skills Program, or JOBS, which all states must have in effect by October of 1990. States can elect to replace existing work programs with jobs as early as July of this year. I intend to assure speedy implementation of this act with the issuance of program regulations early this spring. We must do all that we can to encourage welfare recipients to become productive members of the country's workforce. Welfare reform also made improvements to child support enforcement, and I want to report to this committee today that child support collections continue to rise. We project that increases in 1990 will exceed 1989 estimates by 17%, or a total of $931 million. The strong congressional commitment to enforcement activities has helped bring this important parental financial responsibility issue to the forefront in state capitals across the country. Preschool children from low-income families must be encouraged and given the opportunity to develop all of their talents. Head Start has been doing this for more than 20 years, and President Bush's priorities include a $1.5 billion appropriation for this program, a 20% expansion. Because of that, up to 95,000 additional children, or nearly 550,000 in total, will be enrolled in Head Start centers across the country, developing skills and enriching their minds and their bodies. Third, we must seek ways to strengthen family life and reinforce our society's sense of community, our shared sense of responsibility and commitment one to another. As President Bush has noted, family is a powerful word, full of emotional resonance. And those of us who have been blessed with strong families must work with those who have not such blessings. Attention to family means that the health of our children must be of particular concern, for nothing less than our nation's future is at stake. Today, that future is threatened by the epidemic of drug abuse among our young people. I am deeply committed to the battle against this scourge and will work long and hard with this committee, with the President, and with the President's drug advisor in pursuit of victory. Young people must be educated to recognize and acknowledge the destructive impact of illegal drug use. President Bush has requested $35 million to initiate a new program to stimulate community partnerships. Parents, schools, businesses, and community leaders in order to develop innovative drug abuse prevention strategies. We must also do more to help drug abusers reclaim healthy lives. The budget priorities of President Bush include $30 million for a new treatment initiative to aid communities with severe drug problems, to expand treatment services. We must also remove barriers to adoption, to help ensure that all children have an opportunity to grow up in a loving family and in a safe and nurturing home environment. The budget priorities of President Bush include full funding adoption assistance payments to families adopting special needs children, complemented by a federal income tax deduction for one-time costs of adoption. Caring for the needs of the homeless exemplifies our commitment one to another. By full funding of the McKinney Act, this department will assist communities in bringing to the homeless critical primary care services, mental health care, and a wide assortment of social services. A total of $189 million is directed to these specialized McKinney Act programs. Fourth, we must sustain our biomedical research efforts in the quest for a cure for AIDS, and I support that interest in our National Institutes of Health. As the President has said, we must commit the resources and the will to find a cure. American science must know that we have the resolve to beat this disease. At the same time, however, we must not slight our efforts to find a cure for cancer, diabetes, heart disease, arthritis, and other disorders afflicting our citizens. The Public Health Service will be spending $1.6 billion in 1990, which represents a 24% increase in the budget on a wide array of AIDS research, prevention, and education activities. This unprecedented and enormous federal fight against AIDS was advanced so rapidly only because of the knowledge gained through biomedical research over the last half-century. The National Institutes of Health, the embodiment of biomedical research in this country, and recognized worldwide for its excellence, will have $6.8 billion available in 1990 for research on a variety of disorders, in addition to the $753 million of that amount which has been targeted for AIDS. Within the NIH increase, the President proposes a 6.6% increase for non-AIDS basic research and $100 million for the Human Genome Mapping Project. Finally, in an era of limited resources, we must focus those resources on the poor, on the disadvantaged and the neglected in our society. We must focus first on the populations most at risk, mothers and children. Programs like Medicaid must be carefully administered so that rural and inner-city health care needs are met, and the nation's poor are accorded decent care with dignity. We will soon send to the Congress legislation to enhance Medicaid services for children, including expansion of immunization services. I'd like to return now for a moment to the question of Medicare spending. Within the department, the rising costs of Medicare continue to be the primary force driving excessive budget growth. If no spending restraints were imposed, Medicare benefit outlays would grow at a rate of over 14% in 1990 to a total of approximately $110 billion. However, simply extending three provisions, the 85% capital payment, the 25% Part B premium floor, and extending clinical labs limits would retain the policies currently in effect in this fiscal year. Allowing these provisions to expire would increase Medicare spending by about $2 billion in 1990. Even with other proposals totaling about $3 billion in outlay reductions, the Medicare program will still grow by 10%, or $10 billion in 1990.
However, it does take the family out of the workforce, no question about it, especially if you have a major head injury where the child is on a respirator, can't think, can't talk. Many children, believe it or not, can still hear and still have sensation. So one of the things that we use as a rehabilitative technique is to use the family and the parent, or the mother or father specifically, to touch and talk to the child, because we do think that makes a difference in the long term. But I think the policies have to be analyzed from a multifaceted level, and I don't think it's a very simple problem just to say that having the parent present is going to change the incidence of